Good afternoon. My name is Ben Chandler. I'm the president of the Foundation for a Healthy Kentucky, and I want to welcome everybody to our 18th annual Howard L. Bost Memorial Health Policy Forum. Of course, we're doing things a little different this year because of the pandemic. Instead of meeting together for a full day, we've turned the forum into a monthly webinar series. We're delighted that you've chosen to join us for the first webinar in the series. The Foundation for a Healthy Kentucky is a nonprofit, nonpartisan 501c3 organization that has one goal. We work to improve the health of Kentuckians. Toward that end, we offer this forum free of charge. In memory of Howard L. Bost, the forum is designed to highlight programs and policies that, based on real-world evidence, actually improve health. We believe that bringing together advocates, providers, and policymakers to learn about these programs and policies can help Kentucky adopt, implement, and expand health success stories. The title of this year's forum is Moving Kids Toward Natural Highs, and we're focusing on programs and policies that help move Kentucky kids away from substance use, suicide, and other risky behaviors, and toward more natural, healthy behaviors that will benefit them throughout their lives. This is the first of 5 webinars, and we hope you'll join us for each of the others. Our partner in this year's forum is Kentucky Youth Advocates, the Commonwealth's independent voice for kids. I know you join me in thanking them for their work to improve child well-being in our state. I'm happy to introduce today's moderator, Vivian Lashley Bibbs. Vivian is Director of the Office of Health Equity in Kentucky's Department for Public Health. Vivian also serves as Vice Chair of the Foundation's Board of Directors. I will leave you in her capable hands. Vivian?
Thank you, Ben, and welcome, everyone. The title of today's webinar is The State of Child Health in Kentucky. We thought it was important to start this webinar series with a mutual understanding of where child health currently stands, especially in the light of the COVID-19 pandemic. We'll have 4 speakers today, and I'll introduce each of them, and they will speak for about 10 minutes. Then we'll open the webinar up for audience questions. But I want to share a few housekeeping items before we get started. Hopefully all audience and speaker microphones should now be on mute. This helps reduce background noise. If you're posting on social media about this webinar, please use the hashtag 20BostForum so we can see. You're welcome to write in your questions at any time during the webinar. You don't need to wait until the question and answer session at the end. Just type your question when it comes to you in the box at the bottom of the webinar screen. And if you want an answer from a particular speaker, please note that so I can direct the question appropriately. I'll try to get to every question during this live webinar. If I don't get to yours, please know that we'll capture the question and get a response to you later after the webinar. Finally, this webinar is being recorded and will be posted on the Foundation for a Healthy Kentucky website later this week. We'll show that link at the end of today's webinar. So now let's get started. I'd like to introduce our first speaker for this afternoon, Dr. Terry Brooks. Dr. Brooks is in his 16th year as the Executive Director of Kentucky Youth Advocates. Before joining KYA, Dr. Brooks served as a teacher, principal, and Central Officer Senior Administrator in a variety of districts throughout Kentucky. He later led teams of educators, business leaders, and health and human service professionals with a focus on turnaround projects in a variety of American communities as a Senior Reform Associate with the Community Training and Assistance Center. During his tenure at Kentucky Youth Advocates, this organization has grown significantly as the independent voice for Kentucky's children. KYA believes that all children deserve to be safe, healthy, and secure. Dr. Brooks.
Hey, thank you so much. First, a simple acknowledgement of what everybody participating in this forum knows, and that is how lucky Kentucky's kids are to have Ben, Bonnie, the entire foundation team thinking about and speaking up for them. We at KYA are lucky to have the chance to work with a number of terrific partners on a local, state, regional, and national basis. And I just need to say that the foundation sets the gold standard when it comes to applying rigor in research and creativity in solutions around kids, family, and health. My homework for this afternoon and my goal is to paint a broad portrait of what it means to be a kid in the Commonwealth, and then to both challenge and invite you to be part of efforts to make Kentucky the very best place in America to be young. In thinking about the state of the state's kids, a primary source of our data is Kids Count. As a reminder, Kids Count is a national project of the Anna E. Casey Foundation with a partner in every state, and in Kentucky, that Kids Count partner is KYA. Annually, a national report card for kids is issued in which we take a look at where Kentucky stands in comparison to our own historical data and how we compare to other states across America. Then in late fall, KYA releases its own Kids Count County Data Book, which disaggregates each data point being measured county by county. The intent of that fall release is parallel to the national release. Counties can look at their own trend lines, where they're improving and where they're declining, and also give a look at how their county compares to other localities across Kentucky. So where do Kentucky kids stand in 2020? Before we get specific, let me be clear that these numbers have to be seen as dynamic and formative rather than summative. That frankly is always the case, but never more than in the midst of COVID. No one, and I would emphasize that no one, can truly predict how the pandemic will impact these numbers. But I do think it is a reasonable hypothesis to suggest that the pandemic will exacerbate current trend lines. In other words, I think what these numbers are suggesting will fit the post-COVID landscape, but perhaps be intensified. It's one thing to report that Kentucky stands at 37th in overall child well-being. It's another to dig a little bit deeper. Perhaps no data point illustrates that hypothesis better than economic well-being. There is good news in the sense that the overall trend around childhood poverty has improved over the last few years. That improvement has not been huge, but it was, or at least used to be, moving in the right direction prior to COVID. But let's be clear, we still had more than 1 in 5 Kentucky kids living in poverty. 1/3 of Kentucky's kids with parents lacking full-time, year-round employment before the pandemic began. Additionally, we cannot talk about this domain of well-being without acknowledging the disparities around race that pockmark this sector. While 1/5 of Kentucky's white children live in poverty, 1/3 of Hispanic children, and almost 1 in 3 of Black children live in poverty. There are clearly systemic factors at play when Black and Hispanic children are more likely than their white peers to be poor. If economic well-being is being negatively impacted by COVID, is there anyone who wonders about the impact of this pandemic on kids and reading, writing, and arithmetic? When we think about K-12 education, I frankly think pre-pandemic, there was already too much happy talk and too little real talk. I mean, the latest numbers, remember, this is pre-pandemic, showed that 65%, 2 out of 3 fourth graders, were not minimally proficient in reading. 71% of 8th graders were not proficient at a minimal national level in math. Those key indicators of future economic success and educational attainment also show glaring disparities by race. Among Kentucky's public school children, fourth graders, almost 90% of Black students, 3/4 of Hispanic students, and 2/3 of multiracial students were not proficient in reading compared to their white peers, who aren't faring much better at 61%. Along with kids count data, the issues of what it means to grow up young in Kentucky can also be better understood with additional data. As an example, Kentucky has the highest rate in the nation of victims of abuse or neglect. Kentucky has the 3rd highest rate in the nation of children who have had an incarcerated parent. Incidentally, Kentucky also has the highest rate in the nation of children being raised by kin outside the foster care system, primarily by grandparents. Almost 100,000 kids find themselves in that situation. Experiencing child maltreatment and involuntary separation from parents are both adverse childhood experiences with the potential for serious long-term health impacts and shortened lives if not countered with protective factors that build resilience. There is not a person on this call, and that includes Terry Brooks, who has not received some data report, even a well-designed and a well-crafted one, read it, and then turned it into a dust collector on your desk or on your bookshelf. I want to challenge you to think about these numbers as catalytic forces for kids, and specifically as galvanizing forces for kids' health. There is a lot of talk about social determinants of health, and we need to make sure that talk about social determinants become action levers for better health. And we know how to do that. There is not a better example than how the Foundation tackled the epidemic of youth vaping. Ben, Bonnie, and partners didn't just use a mountain of scientific and medical data when they went after that challenge. Instead, they dug in to the social and emotional forces at play, the economics involved, and innovative assets like Youth Voice. Yes, the Foundation attended to the head arguments around vaping, but I would suggest that that effort was successful because we all paid attention to the heart aspects of the issue as well. So can I suggest that there is a tsunami of boundary issues around social determinants that are flooding the lives of kids every day? And can I suggest that the 2021 and 2022 legislative sessions are the perfect opportunities for us to act on those canary in the coal mine ideas? As an example, there is significant bipartisan support to integrate trauma-informed and resilience-building capacity to schools as part of a follow-up to the Safe School Acts. I mean, how do I say it? We can shape what this means. We can maximize budget resources. We can literally shape the next 4 or 5 years of social and emotional support potential within the K-12 context. Or we can let others shape it. I vote that all of us are the architects of that next chapter. Or let me raise another. There was lots of good news in the Kids Count Health portfolio in 2020. As an example, since full implementation of the Affordable Care Act and Medicaid expansion, Kentucky has had record low rates of uninsured children. And yet on the newest Kids Count indicator, childhood obesity, we see that Kentucky has the second highest rate in the nation. 38% of Kentucky's kids aged 10 to 17 are overweight or obese. So how do we begin to even address this issue? Now, I don't think that Ben is going to let me have 3 hours this afternoon. So instead of answering that question, I want to ask you to begin to answer that. What does that obesity number mean around local efforts in your community? And what does that obesity number mean in target sectors like schools and early childhood? And what does that obesity number mean in terms of COVID? And what does that obesity number mean in the context of regional and racial disparities? And what does that obesity number mean in terms of action in Frankfurt? I mean, you get it, right? And because I know you get it, let's make sure that among the takeaways of this 2020 Bost Forum is a profound recognition. Whether it's obesity or vaccines, hard to cover kids or little boys and little girls inundated with life's traumas, we have to ensure that Kentucky's health policy attends to core issues and social determinants. That Kentucky's health policy for kids is about local action and state action. That health policy depends on big-time players like the foundation, but it also depends on each of us. And yes, that means you. Thanks so much for joining us and the foundation in being part of this first conversation today.
Thank you, Dr. Brooks. You've given us a lot to think about. All of those questions kind of made me kind of think of how I in my position and what I do can advance some of those social determinants and equity issues as it relates to population health in Kentucky with our kids. So again, thank you. Our next speaker will be Dr. Hatim Omar, who is a professor of pediatrics and of obstetrics and gynecology at the University of Kentucky and founder of the Stop Youth Suicide campaign. He obtained his medical training in Bulgaria, West Virginia, and New York. He is board certified in pediatrics and adolescent medicine and the founder and chairman of Stop Youth Suicide campaign. Dr. Omar will share with us how the pandemic is affecting teen mental health based on his research, and he will also share what we can do as parents and as a society to support youth mental health. Dr. Omar.
Thank you. Good afternoon, everyone, and thanks for the organizers for having me on and having this talk. Since the pandemic started, I've been working with Randa Bush from New Vista, Lexington, to address the issues that happened during the lockdown and what's happening since the pandemic started. I was originally supposed to talk about youth suicide, and then the pandemic hit and things changed a little bit because we are dealing with new reality. So I want to start with where we were before the pandemic in terms of mental health or youth suicide. And sadly, over the last 2-3 years specifically, we had really sharp increase in the percentage of teenagers or young people who are going through a rough time, from depression to anxiety to suicidal ideation to suicide attempts. And the latest data we have from the Youth Risk Behavior Survey is really the most disturbing since I've started working with preventing youth suicide 22 years ago. If you see on this slide, you can see that we are dealing with roughly over 10 to 12% of our kids say that they had attempted suicide over the last 12 months. And this is different in terms of racial or ethnic backgrounds. As you can see, American Indians or Native Alaskans have the highest. Roughly 1 in 4 kids have attempted suicide. Multiple race is second in this. There is a significant change. Up to maybe 3 years ago, generally Black and Asian kids tended to have the lowest suicide attempts. Over the last 3 years, we have a lot higher, almost 3 times increase, 3-fold increase in suicide attempts among African American kids, which wasn't the case before. I'll move on to, I think, Alexa, you put my old one, not the correct one. There are 2 slides missing. Can I upload one from here?
No, unfortunately not.
Okay. Well, what I wanted to show, there were two other slides. One showing the increase in the number of children who are contracting the virus, the COVID-19, because a lot of our politicians and some people keep telling people that, hey, young people are okay and they don't get the virus, and if they get it, it doesn't kill them, which is really a myth. It's not accurate. Young kids as young as 1 month old can get the virus, and there is a sharp increase in the number of kids getting the virus. As a matter of fact, the sharpest increase in the last about 8 weeks is among people under age 18. So we are dealing with a much higher level of infections in the virus. So I wanted to discuss a little bit about how did teens feel during this pandemic, what are the key areas that they're struggling with, and what can we do to provide support for them. Having in mind that this is what we call a situational trauma, which is when something happened, either man-made or natural disaster or technological problem like war or abuse or violence or a medical issue like what we're dealing with here. And what that means is you have an event, in this case the pandemic. What's the experience that our teenagers go through during that event, and what short-term and long-term effect can it have on them? So one of the things we did is ask teenagers who get in touch with me and with Randa through the Stop Youth Suicide Campaign website, if they want to describe with one word what they are feeling. And the responses are varied from frustration to uncertainty, hopefulness, disengagement, indifference, creativity, anger. And those are really, varied types of response. Like here is a chart of what are the most common feelings that teens have responded to us on. And if you see the anger, frustration, and confusion are the leading three feelings that teenagers tell us feel. Some of them feel sad, some feel bored, but generally everyone has one way or the other feeling in this new age that they are doing. And the key for us as grown-ups or as adults, parents and teachers and anybody who deals with teens, the most important thing for us to remember is that teenagers will not remember what we said or did. They will remember how we made them feel later in life. So the key issues that our teens are struggling with during this pandemic is boundaries, regulations, connectedness to others, active engagement, self-care, and how to deal with it. And what our role, or what every parent, every adult role should be at this point is use what we call trust-based relational intervention. That means provide safety, or at least felt safety and security to these teens, provide a lot of hugs, even though generally teens don't like physical contact. This is a time where they actually crave that type of contact from a parent, from a loving adult. All of us should be authentic in our own self and acknowledge when it's okay to say, I don't know, we don't know what the answers are. But most importantly, be available to our kids and repair any kind of relationship that was not doing well. We still need to have a balance between empowering the teen to do their own thing, while at the same time helping them with how to handle those things. It is very hard on parents because a lot of parents who lost their jobs or lost their insurance or they're behind on their mortgage or their rent, and it's getting worse as we stay longer in this. But nevertheless, we can still equip teens with some skills to respond under stress by us ourselves learning how to respond under stress. Try to utilize moments and shared experiences. Don't leave our teens to their own devices, and encourage them to stay connected to other teens or other people that they like. We need to work on helping them stay sane and better mental health by seeing the big picture and having realistic expectations. The New Vista had done something, I'm going to just say one word on this, which is the dinner table project that might be helpful for families. It's free for Kentucky people, and you can get it through their website. It helps adults deal with it. I want to say a few things about when to seek professional help for your teen, and to understand that it's okay if you think you're not okay. So if your teen is sleeping too much or barely sleeping at all, if they're eating too much or not eating at all, if they are more irritable than usual, feel sad and fearful or numb, if they are thinking thoughts that scare you, if they can't really find a way to relax and they have no motivation to do anything, if they're being isolated all the time and withdrawing, spending all their time on social media and not doing anything else, if they're fighting with parents and friends and family members and feeling unsafe, any of those things, really, this is a time where we shouldn't wait long. We should seek professional help for our kids, because if we don't, then ultimately we'll end up with increased level of suicide. There are a few resources here listed, and I'll be happy to address more during the questions. So thank you. Appreciate having me.
Thank you, Dr. Omar. Next, I'd like to introduce Dr. Henrietta Botta, who's my colleague in the Kentucky Department for Public Health. She's the Mary Florence Jones Professor of Pediatrics and Vice Chair of Academic Affairs for Pediatrics in the UK College of Medicine. She also directs the Division of Maternal and Child Health here at the Department for Public Health. Her areas of research include neonatal abstinence syndrome, and she will discuss the health status of Kentucky children from birth through elementary age, with a particular focus on the effects of substance use on child development. Dr. Botta.
Thank you. Thank you for the introduction, and it's a real pleasure to be one of the panel speakers. I will briefly discuss the early childhood years, the children's exposure to risks, but most importantly, the factors that can mitigate these risks. This slide shows children with different issues. They are not created equal, from the one who was born very premature, a twin with severe lung disease and had to go home with special needs, with oxygen and on the ventilator, a baby with fetal alcohol syndrome, one with hydrocephalus and spina bifida, and a nice-looking infant at the center who was treated for neonatal abstinence syndrome. Indeed, we would want each one of these children to reach their developmental potential. Let us look into the socio-ecological framework to assess the trajectory of a child's development. Definitely, there are factors within the child, mostly biological factors such as prenatal drug exposure, the poor growth in utero from maternal complications or poor nutrition, temperament, and other characteristics that will influence development. To the child's immediate environment or surrounding is the exposure to family, forming that interpersonal relationship to a caring adult, and we call that attachment. Outside the family-child relationship is the surrounding environment, the home, the neighborhood, and community, and with direct and remote influences, policies that will affect growth and development and the child's well-being. Hopefully, we will have policies that are to promote, protect, and prevent diseases or disorders, and in effect, for the lifespan. This is a busy slide, but this is to call your attention to the importance of promoting health very early, even before conception. As we look into this framework of the individual child, the family, the community, and policies, we note the multiple risk factors at the lower part of the slide, but there are also numerous protective factors, the upper part of the slide, that may be able to mitigate these risks even at the very early age. For example, healthy pregnancy and wholesome attachment is in a nurturing family and home environment as an early focus of intervention will mitigate, if not prevent, exposure of a child to adversities. This slide merely emphasizes the risk of substance use, pregnancy complications, maternal depression and stress to the unborn, and after birth, the risk of exposure to continuing drug use in the home, domestic violence, other types of abuse, and other factors, including, of course, COVID-19, which can worsen all these risk factors. However, with prenatal care and nurturing parenting, a healthy child is born and prevention of adverse childhood experiences, or ACEs, become possible. And related to intervention services, we have HANDS, or the home visiting services, early intervention services, and early childhood mental health services that can be provided to these families. Instead of ACEs, or adverse childhood experiences, depicted as a pyramid, we see this slide a tree showing the pair of ACEs, two views of ACEs, a view of what we can easily see above the ground, physical, sexual, verbal abuse, criminal justice involvement, substance use, and others, and those factors that may not be obvious. Adverse experiences are often rooted in factors or examples such as poverty, discrimination, lack of opportunity, and community disruption. And these we have heard early at the early part of this panel discussion. We also know that the lifelong perspective teaches us the life is a continuum of exposure to risk and protective factors, and in some, the risk factors weigh heavily than protective factors, and this balance differs as to race and disparities in the outcomes that are noted. The risk versus protective factors is a continuum throughout life. Therefore, we must recognize and prevent risk as early as possible. We need to enhance protective factors to mitigate risk. We must build resilience. Resilience represents a process and not necessarily a characteristic that one is born with. Resilience is the ability to overcome serious hardship. The foundation of resilience is the combination of supportive relationships, adaptive skill building, and positive experience that reinforce self-efficacy, perceived control, and belonging. Resilience requires relationships, and this has to start early. The capabilities that underlie resilience can be strengthened, however, at any time. To summarize, exposure to violence, trauma, or adverse childhood experiences is the single most prevalent risk factor for children today. Adversity is necessary for life and learning, but adversity, when repetitive, chronic, and severe, does not allow for recovery. This becomes toxic stress. Toxic stress disrupts life and learning, and relationships are necessary for resilience. The lifelong toll of unaddressed adverse childhood experiences is a major cause of death and disability in adults. Knowing what we know now, we can do better in preventing, mitigating, and treating toxic stress. From Dr. Robert Anda, quote, "Adverse childhood experiences are not destiny, and early trauma does not have to dictate life's story. Research shows that protective factors, chiefly the presence of a nurturing adult, can cushion the impact of adversity in a child's life." I want to end with a quote from a colleague of mine who was one of the pioneers in neonatology, Dr. Sheldon B. Coronis. Some children thrive happily, others languish sadly. Are they not all ours? Ladies and gentlemen, it is not going to be easy, but let us always remember the Children's Bill of Rights from the late Billy Andrews, a child advocate and my mentor. The level of civilization attained by society will be determined by the attention it has paid to the welfare of its children. Thank you.
Thank you, Dr. Bada. I love those last two powerful quotes. And with your permission, I may be using those at some time in the future. Next up is Ben Robinson. Thank you. Next up is Ben Robinson. He's a senior at Daviess County High School who plans to attend the University of Kentucky next year. He's a member of the Kentucky Youth Advocate Student Advocate Team and a Governor Scholar. This forum is about children and youth, so we're delighted to welcome the youth voice to each of our webinars. Ben is a tireless youth advocate, and he's going to share with us some of the work he's been doing to reduce tobacco use and combat obesity among his peers. Ben?
Hi, everyone. My name is Ben Robinson, and I'm here to talk to you today about the state of children's health in Kentucky from a youth's perspective. Next slide, please. So I was already given an introduction, but just to go a little bit over it, I'm currently a senior at Daviess County High School. I'm an involved member of the Kentucky Youth Advocates. I'm on the swim team at my high school. Right below that is a picture of my church, First Presbyterian, where I'm an active part of my youth group. And I was also part of the Indoor Winds Ensemble at Daviess County. And that picture in the bottom left is from our most recent season. Next slide, please. So what I first wanted to talk about today was my involvement with Kentucky Youth Advocates and how that led me to help petition for Senate Bill 56 to be passed. Just a quick background on what Senate Bill 56 is, in case you didn't know. It raised the minimum age to purchase, possess, or use tobacco and/or alternative nicotine products from 18 to 21 years old. This ensures that teenagers are able to better grow up without the influence of tobacco products, as it helps to eliminate their prevalence in our social circles. Not many high schoolers hang out with 21-year-olds as opposed to 18-year-olds. Such a simple solution will surely have lasting impact, as it eliminates the ease of access that was there previously. Furthermore, my involvement with KOA has only made me a better person, and I wanted to tell you all how you can get your youth involved in petitioning for change. If you could go to the next slide, please. So the pictures you're looking at right now are from this year's most recent Children's Advocacy Day at the Capitol. Children's Advocacy Day is hosted in order to better ensure that Kentucky's legislation has children's needs met. Examples of this include successfully passed Senate Bill 56 and current ongoing bills like House Bill 22, which seeks to end corporal punishment in schools, or House Bill 32, which seeks to raise the tax on e-cigarettes to discourage further use. And just a quick clarification of what I mean by passed as in signed by the governor and is now the law. House Bills 32 and 22 are still on their way to the governor's desk. It's our job as youth to try and speed up this process by displaying the urgency of which we want these bills passed. I did this by not only attending Children's Advocacy Day, but by meeting with Kentucky Senate and House members and telling them, from the youth's point of view, why these bills should be passed. It's important for youth to be involved in this capacity, as we're the ones the bills are aimed at. If you look at the next slide, and could you go to the next slide, please? There's another photo from Children's Advocacy Day, and right after that, if you go to the next slide, please, is a photo of my friends and I at a leadership training conference. This conference was hosted by Green River Health and taught us not only about the dangers of substance abuse, but what we can do as youth to speak out against it. So this leadership training conference was different from my involvement with Children's Advocacy Day because it wasn't a direct meeting with legislators, but rather focused on doing what we can to create a culture change at our own schools. The emphasis of this conference was creating a grassroots movement and using our own connections to reach out to our peers to tell them about the dangers of vaping and substance abuse. This is important because big companies like Juul are notorious for lying to their consumers. The next slide here shows the thumbnail. Oh, sorry, next slide, please. shows the thumbnail for a YouTube video my school district made in which my peers and I spoke out about the dangers of vaping and dispelled common misconceptions that surround it. While I can't play the video right now, it should be available in the follow-up if I'm not mistaken. The importance of this video stems not only from the message, but also the people delivering it. Teens are tired of hearing from adults telling them about the dangers of vaping, but the message becomes a lot clearer when it's a friend of yours pointing out how awful vaping is for your body. If you could go to the next slide, please. While vaping is an ongoing threat to the health of Kentucky's children, we're also facing another threat that's been steadily building for decades now. This threat is the rising rate of obesity in not only adults, but our youth. Taken directly from a Foundation for a Healthy Kentucky release, and I quote, "For high school students, Kentucky ranks 3rd out of 43 states reporting, with a rate of 20.2%, up from 18.5% in 2015. The percentage in question is what percentage of high schoolers are obese. That means we're now up to where more than 1 in 5 high schoolers are obese. Such a startling statistic comes at a dear price. Not only does this monetarily cost billions in medical bills, but also drastically affects the health of those children. They're at a greater risk of coronary heart disease, type 2 diabetes, high blood pressure, and many more medical complications. Now, I understand fighting the rising rate of obesity isn't as magically as simple as telling people to eat healthier or get exercise. I know that there's a vicious cycle of poverty undermining the solutions. Yet my ability to create change in the youth stems from my ability to put my energy to use and do whatever I can. This takes shape in volunteering for organizations and projects like Ohio County's Longest Day of Play. Next slide, please. By volunteering at Longest Day of Play, something that's a national initiative that's led by cooperative extension offices, and something I've also been doing since I was roughly the age of 11, I do what I can with my given abilities to ensure change occurs. As a youth, I don't have the ability to make large monetary contributions or make plans that affect the whole state of Kentucky. My time, however, is completely free, and I, much like other youth, give that willingly. If you could go to the next slide, please. Longest Day of Play is an idea centered around getting young kids outside and exercising in the best way possible, by playing games. In 2019, there were over 1,200 participants. Sorry, I lost my train of thought there. There were over 1,200 participants, with 200 of those being volunteers. There were over 30 activity stations with games designed to be replicable in the kids' own backyards. A comparison of how much Longest Day of Play has grown is that in the first year, 2008, there only had 300 participants, including the volunteers. Such an initiative is made possible through the sustaining partnership between the local hospital, school system, and cooperative extension office. Next slide, please. One second, I'm sorry. Here's some games that are played at Longest Day of Play. I apologize, I had left my note card. On the left, you have the ever-popular butterfly jump, and I have no clue where the name came from, but it seems to have stuck. As you can see, it's as simple as having kids jump over sticks at varying lengths and timing them. By having them try to beat their previous time, you can guarantee repeated fun. On the right, you have the classic beanbag jump. All you have to do is get everyone in a beanbag and have them race across the finish line first. Both of these games are designed to have an element of competition, simplicity, and fun, blended just right to be engaging, while also easy for anyone to do on their own. Take the butterfly jump, for example, on the left. Don't have soccer cones and rods? No problem. You could always just use regular old sticks or broom handles. For the beanbag jump, no beanbags lying around the house? Just use an old pillowcase. By being replicable, Longest Day of Play increases the chance of the kids, and the families for that matter, doing the same games at home and getting out and exercising. If you could go to the next slide, please. So the most popular way community involvement is increased is through for participants. Having free food provided to everyone who completes a certain amount of activity stations. So better yet, the school district brings the Meals on Wheels bus in order to provide a meal to all children, regardless of what they complete. Such a simple addition helps to boost the number of people willing to come just to have a fun family outing with a meal provided. If you could go to the next slide, please. And the most popular way community involvement is increased is through the prize giveaways at the end of the event. At the beginning of Longest Day of Play, everyone's handed a pamphlet with the different stations on it whenever they sign up. For each station they go to and do the activity, they get a check mark. After completing a certain amount of these stations, they turn their pamphlet in for not only their free meal, but also into the prize drawing. These prizes are generously donated through cooperating businesses and all specifically pertain to getting kids outside. They range from bikes to water slides, free reservations at nearby campsites to footballs. These prizes not only get people to stay to the end, but also give them something to use from everything they saw at Longest Day of Play. The bikes allow kids to get outside and bike to exercise. The football and soccer balls can always be tossed around in the yard. And the camping trips are quality family time in the great outdoors. The main takeaway from Longest Day of Play is that it teaches all sorts of new ways kids can get out and exercise. If you could go to the next slide, please. The most important thing Longest Day of Play does is make sure that everything's done in a safe and healthy play environment. This comes back to my previous topic on the dangers of tobacco and nicotine alternatives for youth. As seen by the sign on the slide, no form of tobacco is permitted. This guarantees that not only do the kids have an immediate safe area to exercise in without inhaling vapors around them, but it also establishes a precedent for future activities to be done without smoking. We all want Kentucky's kids to grow up happy and healthy, and the best way we can do that is to do our part to combat childhood obesity and the dangers of vaping. If you go to the very last slide, please. As for my last slide, I'd like to thank the Foundation for Healthy Kentucky for giving me the opportunity to speak today. I'd like to thank Kentucky Youth Advocates for giving me so many opportunities to be involved in making change. And most importantly, I'd like to thank you for taking time out of your day to listen to me speak. I hope I was able to give you something you didn't know before. Thanks again.
Thank you, Ben. And thank you to all of our speakers today. I'm going to kick off our Q&A session with a couple of questions that I have and a couple of questions that have come in. I will start with the one that I'm seeing first. And the question is this being recorded for later access, and will the slides be available? And yes to both of those questions to Ms. McKee. I want to start with Ben, if you can answer this question for us. I saw the photo of you and your peers grouped together at the Capitol, and it looked like at your local high school. Can you give us a sense of the reach across the state as far as the different counties and districts that have Kentucky Youth Advocate groups like the one at your school?
Yeah, for the Kentucky Youth Advocates, if I remember correctly, I was on a panel with, I want to say, kids from 7 other counties, maybe. And for the Green River Health Group, I think there were 12 different counties involved.
Great. And how does a school go about wanting to be a part of that? How do they get that information? How do they become a part of the Kentucky Youth Advocates?
They would need to reach out through their, I think they're called For Risk Youth Advisors. It's an employee at the school that deals with all of that.
Perfect.
So if anyone had a youth member that wanted to get involved, they would just talk to them.
Gotcha. Appreciate that. I want to go back to Dr. Omar, if he's still with us, the question. Knowing how both adults and our teens are struggling with this pandemic and tensions that may be in the home, if a parent's not able to do some of those interventions or some of those things that you listed on your slides, how do we go about addressing it when both parent and child are experiencing mental health stress and other issues related to this?
Yeah, that's a great question because this is exactly what's happening right now. In the beginning, parents were trying to help their kids, but as you know, many of the parents that lost their job and they were receiving unemployment benefits, and those unemployment benefits are, moving away. Some of them can't pay their rent and things. So there are issues that the country as a whole or the state has to do that unfortunately it's not in our hands. It's in the hands of politicians to step in. And that's really the difference between us and the other developed countries where, like Scandinavian countries where everybody got part of their salary continued and will continue to be paid as long as they are not working. So those are the things that we don't have control on. But there are things that the parent, together with the kid, can seek help together, because the reality is the parents need as much help as their kids. So finding, we don't have outstanding resources here overall, not just in Kentucky, but in the United States as a whole for mental health support. But nevertheless, your physician or your medical provider can help you find some kind of support for the parent as well as the kid. And that's the best you can do at this point. The rest is really for all of us to come together and ask our politicians to leave politics out of public health and right now just focus on the public health issue.
Thank you. This next question is kind of open to anyone on the panel. The question is anyone doing prevention training with parents in early recovery from diseases of addiction? I've found parents in early recovery really want to know how to prevent substance use by their children. Anybody have an answer to that?
So this is Omar again. I was doing parent education through the schools and PTOs in multiple school areas and multiple communities over the last 20 years when I was still at UK. I retired from UK last month, but those I found to be actually effective when we start talking to the parents. For example, I used to do a boot camp for parents in the in some of the middle schools here in Lexington, where just before their kids get into sixth grade in middle school, we would do training sessions for the parents, what to expect over the next 2-3 years, what are their kids going to be exposed to, how can they respond to it, like how can they prevent it before it starts, because prevention is always cheaper and more effective than intervention, and I think that's doable if there is support for it. The previous leadership at UK was always supportive in me doing a lot of community work and things like that. So it is doable, and if we can help parents understand how teens develop and what makes them tick and what can you do to offset things before they start, it is a lot more effective, and it should be. If I were in charge, it should be done for every parent before their kids get into middle school.
Thank you. This next question is for Dr. Bada. In your presentation, you talked about toxic stress and how once that level is reached, it's very hard to have success in impacting long-term health outcomes. So are there any evidence-based strategies on how to prevent us to break that cycle of toxic stress and intervene at an earlier point to ensure that we mitigate that outcome?
I think the important thing is to help these kids before they're exposed to toxic stress. And, when you talk about ACEs, the issue is we're sending these kids home to families wherein you've got all the adversities surrounding them. And if we can intervene, like Dr. Omar is mentioning about parenting and that previous question on parenting, we probably need to start that early on. I would like to see it, especially if there's substance use in the home. I would like to see it that it be done, the parenting be done early on, even during pregnancy and soon after the baby is delivered. And it has to be a strength-based type of a curriculum, meaning you've got to know where the parents are coming from and base it on their experience and develop your teaching, from where they're coming from. And group teaching or parenting would probably be helpful because they learn from each other. If I tell them the baby walks at this age and start talking at this age, they probably won't listen to me. But if another parent would say, I'm not going to put my baby, I'm not going to sleep with my baby because I had a friend whose baby died because of sudden unexpected infant death, they will probably listen. So the parenting classes would be very important for these families. And we have a pilot program in Eastern Kentucky that is really evaluated to be very helpful, and the parents learn from it, and not just with their babies at that point in time, but even they go home and get better relationship with their partners and also with their older children. But of course, COVID hit us, so it's hard to have all these group sessions with these families. But we're able to at least use technology in part to help these families.
Thank you, Dr. Vada. I'd also like to pose a question to Dr. Brooks. You left us with a lot of questions at the end on impacting policy, on impacting communities and how we can address poverty and other disparities. And, a person sometimes can feel overwhelmed by where to start. So how do we prioritize as a state or maybe within the community to determine how we address something as large as poverty and its impact on the health of our kids?
Sure. Before I answer that, I'm going to throw a curveball and make sure that that everybody has a sense of that very first question, which is if you're interested in working with KYA on a youth group, I would simply invite you to contact. You can shoot me an email, anybody at KYA, and we try to customize that. So I saw that was a specific question from Ms. Marchand and other folks in the chat box. I just wanted to reiterate, we will contextualize how to involve you, and please feel free to reach out. So that is a great question around how we begin policy, and there are so many people on this call, certainly Ben Chandler represents this as well, who know how to get things done in Frankfort. I'm sure that we all are aware that there is an element of toxicity and bifurcation in Frankfort and Washington these days. I frankly think that's an opportunity instead of an obstacle, because what we have consistently found is that kids, and frankly, especially kids' health, provide a common ground for legislators and the administration to work on. So what we typically do at KYA is we bring together anyone who wants to come. The table is open, and the table is open to anyone on this call to join our efforts in the Blueprint for Kentucky's Children. Again, you can reach out to us, and we can immediately let you know how to become involved in that. What we do is we build a consensus agenda. The emphasis is on a limited number of common ground priorities. Less is more. And then we very upfront shop those to leadership in the House, leadership in the Senate, and the executive branch, whether that executive branch is Steve Beshear, Matt Bevin, or Andy Beshear. And what we try to do, candidly, before the session ever begins, is to have an agenda that everybody can win on. The last 2 or 3 years, we frankly have hit almost 100% success. We've been running over 90% yes votes in the House and Senate on those measures, and it's a reminder to all of us that in an era where it is so easy to shrug our shoulders and to feel like nothing can get done, things can get done. As I mentioned in my opening remarks, the foundation has been a vital partner with us, and hopefully we've been a vital partner with them on issues from tobacco 21 policy to vaping, issues that a few years ago nobody would have thought could have gotten done in a place with Kentucky's tobacco tradition, and they've gotten done. I was so appreciative of our other speakers talking about those social determinants, adverse childhood experiences. If you look at the recently passed Safe School bill, there was a time where people thought that bill was going to be about how to arm teachers in schools. Instead, it became a mechanism to build resilience among kids. That didn't just happen. That took lots of partners. So we approach policy very aspirationally. We approach it optimistically, and we would approach it invitationally, where if there is anybody on this call that wants to be part of policy and kids in Frankfort in 2021, please reach out to us at KYA. You will hear back from us, and we will welcome your engagement.
Thank you, Dr. Brooks. That's all the time we're going to have for live questions today. There are additional questions that have come in into the Q&A box, and one will be specifically forwarded to one of our presenters. It's personal in nature. And then other questions that were not answered, we will be responding to those in days ahead. This webinar will be posted at www.healthy-ky.org later this week. I joined the Foundation for a Healthy Kentucky and Kentucky Youth Advocates in inviting you to share the link within your networks. I want to draw your attention to our next webinar in the Bost Health Policy Forum series. It will occur on Monday, October 19th at 2 p.m. Central Time. The title is Intervening Early, and our speakers will discuss programs and policies that can improve the health of our youngest children. So we look forward to seeing you then. So I wish you all a very healthy and safe rest of your afternoon. On behalf of the Foundation for Healthy Kentucky, thank you.